Good day, everybody. I'm Dr. Saad Al-Bayati. I'm an oral radiologist in the College of Dental Medicine, University of Sharjah. And in this series of videos, we're going to have an idea about the use of intraoral sensor holders and their different types to be capable of producing images of the best quality. When it comes to other forms of sensors, there is another sensor which is the bite block sensor. This is a sensor that is made from styrofoam, and it is much easier to use, and it is disposable, very light in weight. This can be used with the PSP sensors, and it can be used with the size 1, size 2 films, so it can be used for small mouths, small for children, and it can also be used in adults, the size 2 film. And again, just like we did in the previous demonstration, we will use the smaller size film for purposes of demonstration. So in this type of sensor, you will find here that there are two areas on which the patient is going to bite. 1, 2. There is a slot in between them, and there is I don't know if it is seen here in the camera, there is a slot over here that will allow you to insert the film or the phosphor plate sensor. So this back side of the holder, it will support the film. So what you do is that after you receive the sensor from the nurse, of course it is wrapped in the disposable cover. You go, and I'm going to use again for purposes of demonstration, I will be using the regular film, the analog film, which is very much similar in terms of thickness. So you're going to insert, see, you're going to slide the sensor into this slot all the way down, okay? So either side will fit, either side will fit, as I said earlier. And make sure, please, that this will be the exposure side, and this will be the back side of the film. We don't want the sensor to be, radiographed or exposed to radiation from the opposite side. So you put it midway. Make sure that it doesn't slant in either direction. So this is how it is placed correctly. Now, if you want to place it inside the patient's mouth, this will fit for any side, any tooth inside the oral cavity. So there is no direction preference. You just put it behind the tooth. You can put it horizontally if you want the posterior teeth, and you can put it also vertically if the teeth to be radiographed will be the anterior ones. So the principle is the same. You just make sure that the film is inserted all the way down into this slot so that it would be supported in place. You want the upper incisors or the upper segment or the lower segment, it is the same. You ask the patient to open wide. You reflect the lip so that you see the tooth that you want to radiograph, and then again you will have a look inside the patient's mouth just to get acquainted with the anatomy of the area, if there is anything or any interferences. So let's take the central incisors, for instance. You're going to ask the patient to open, examine the area, and then, just like we did with the previous sensor holders, you're going to, turn it down, utilize the space in the inside the oral cavity, extend it all the way back, and then once you're satisfied, you ask the patient to bite on the block. Okay. So this is the radiograph for a central incisor. Just make sure that the central incisors are behind all the sensors placed behind the central incisors, and I will show you how it looks from the side. Tooth and the sensor. So this will also guarantee the parallel lines between the tooth and the film. And this is how it looks from the front. Now, the difference in this type of sensor holder is that you don't have a guiding ring that will tell you where to direct the beam. So you have to know where your X-ray will be directed, and so we will now we're aiming for the upper central incisors. So our X-ray should be directed to the upper central incisors in this way. There is a chance of concut here if you don't know where to place or where to direct the X-ray beam. I will just show you how it looks from the side, so you will have an idea about the beam direction. So again, this is how would you direct your beam. So the beam will be falling perpendicular on the tooth and the film. This is how it looks for the, or this is how you would direct the beam on the film and the sensor. After you're done, you just remove your X-ray beam out of the way, ask the patient to open, and again, as we did earlier in the previous sensor holders, you ask your patient to open, and then you take the X-ray away out so that you will not touch the oral cavity inside. The teeth here, if you want the central incisors, this is how you place it. If you want the lateral incisors, then the lateral incisor should be in the behind the film. See, lateral incisor is behind the film, and you ask the patient to close. Always the tooth in question should be behind the tooth. If you want the canine, it's the same. Canine behind the tooth, behind the canine, and ask the patient to bite. Okay? And the beam will be directed towards the perpendicular on the tooth. Make sure that the cone completely covers the film or the sensor in this relationship. This is concut, 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 concut. So make sure that the lower border of the bite is within the cone, or even you can extend it down so that you will have flush margin over here, so you will not end up with concut. If you guarantee this relationship, you will not have concut whatsoever. Now, there is a problem here, just like we said earlier, is you don't know where would you direct your beam. So because there is no ring aligner, so there are reference points in when it comes to the cone direction. If you want the central incisors, then your beam should be directed towards the tip of the nose. Central incisors towards the tip of the nose. If you have a larger film, you can include the tip of the nose. You can use the tip of the nose as your reference point for your central and lateral teeth. Now, if you want the canines, then your reference point will be the ala of the nose. If you extend the line from the ala of the nose, it will fall directly over the canine tooth, either side. So, tip of the nose is for the centrals and the laterals. Ala of the nose, lateral border of the ala of the nose, will be your reference point for the lower central inside. For the upper canines.